Welcome to class today. Welcome to class, students. Welcome to class, pupil. Welcome to class, learners. Today, we'll be looking at a very important topic titled bonds. Everyone experience bonds in one way or the other. We have the sun bond. We have, for example, when we are cooking in the kitchen, we experience this bond in our heart or any form of bond. So today we're looking at bonds. Burns are injuries to skin or deeper tissue caused by sun, hot liquid, fire, electricity, or chemical. So burns are caused by different causes. We have by sun, through hot liquid, hot water, through fire, sometimes through chemical and electricity. These injuries can be extremely traumatic, causing severe pain, producing the smell of burnt flesh, and sometimes resulting in charred clothing adhering to the victim's skin. The severity of burns is typically determined by their size and depth, though electrical burns present a unique challenge as they can cause significant internal damage without visible external signs. Symptoms vary widely from minor discomfort to life-threatening condition depending on the burn size and depth. When some burns and small scars can often be treated at home, deeper or widespread burns and those caused by chemicals or electricity require immediate professional medical attention, often in specialized burn units. Symptoms Symptoms of burns are pain, skin changes, systematic responses, and common additional symptoms. Let's look at the pain. It ranges from mild pain to severe pain, while the skin changes from blistering to peeling to redness or complete loss of color. Then systemic responses such as flushing or sweating, while the common additional symptoms are hyperalgesia, increase that is also referred to as increased sensitivity to pain, swelling, and tenderness. The common causes in descending order we have the fire or flame, scarring for steam or hot liquid, contact with hot objects, electrical burns, and chemical burns. Now, classification of burns. We have degree of skin burns. We have the first degree, the second degree, the third degree, the fourth degree as seen on the slide 4. And this can you can cool the burn for first degree and second degree treatment. You can cool the burn with water, apply aloe vera. You can also bandage the burn and take a pain reliever to in order for burn management for first and second degree burn management. You can either cool the burn under the water, apply aloe vera oil, then bandage the burn, then take a pain reliever. For the third and fourth degree burn, don't use oil, don't use egg, don't pop blisters, and don't use ice. The first degree burn, skin is reddened. Second degree burn, skin develop blisters. The third degree burn, skin appears cooked or charred with damage po ten tially ex ten ding to underlying tissue. In severe cases, skin or appendages may be completely burned away. The first critical step in burn management is accurately determining the burn severity level. It's important to note that prolonged exposure to intense sunlight can cause first and second degree burn. So part of the first and second degree burn examples are the prolonged exposure to intense sunlight. For minor burns, first and degree covering the less than 1% body surface. Immediately wash or soak the burned area in cold water. For minor burn, you can soak as being seen in slide 4. You can for minor burns like the first degree and second degree burns covering less than 1% of your body surface. So the first degree and second degree burns are referred to as minor burns. This can be managed or can be treated by immediately washing or soaking your hand or the body burnt area in cold water. Clean the burnt area with mild soap and water, then cover with sterile gauze, then apply snug but not tight bandage. So let's continue. I said for minor burns we have the first degree and second degree burns, and it is can be treated by immediately washing or soak the burn area in cold water, clean the burn area with mild soap and water, cover with sterile gauze and apply a snug but not tight bandage. For severe burns like large burns of any degree, like most likely the third and fourth degree burns are referred to as severe burns. When medical help is available within 30 minutes, treat for shock, transport quickly to medical facility. Do not attempt treatment. That is for the severe burns. When medical help is not really available, outdoor or remote setting, remove clothing from burned area, cut around any clothing stuck to burns, apply antiseptic cream to the burned area, cover with sterile dressing, bandage snugly but not too tightly, treat for shock, provide water or sports drink preferred if victim is conscious, transport to advanced medical care as quickly as possible. So when medical help is not readily available for burn treatment, you should first of all remove clothing from burned area, like where if the burnt area is being covered with any cloth or anything, make sure you move the cloth from the burnt area. Then cut around any clothing stuck to burns, then apply antiseptic cream to the burnt area, then cover with sterile dressing, a clean dressing. You can a clean dress, you can cover it with clean cloth. Then bandage snugly but not too tightly. You should make sure when you're banding it or when you're wrapping the clothes around the wound, it should not be too tight. Treat for shock, then provide water or sports drinks preferred if victim is conscious. If the victim is still conscious, you can give the victim water to drink or sports drinks to energize the victim. Then transport to advanced medical care as quickly as possible. You can you can reach out to any hospital or any medical care close to the person community or the person environment or where the accident take place. So burn injury, when to call a doctor. So look at when to call a doctor is face, hands, feet, genitals burned. When your face is being burnt or the victim hand is burnt or the feet is burnt or genitals burnt, all those sensitive parts of your body. Then when you are in stage 3 or 4 degree of injury, I said that stage 3 and stage 4 degree injury is always referred to as the most serious, is the most critical or the most serious stage of the most critical stage or degree of burns. And it's you can always call the doctor when the victim is in the stage 3 and stage 4. It will be as I said earlier on the other slide. Then injured more than 10% of the body surface, so you can call the doctor when the person is injured or burnt, or the part of the body is burnt, like 10% of the part of the person's body or the victim body is burnt. Then when you have chemical injury, you must call the attention of the doctor. Now, important precaution: do not touch burns with your fingers. Then breathe on burns. You can make sure you can breathe on burns. Then break or drain blisters. Then you can change dressing once applied. Leave this to medical professional. I said do not touch burns with your fingers. Breathe on burns. Do not touch the burns with your, do not breathe on them. sorry, do not touch buns with your finger, do not breathe on them, on the buns, break or drain blisters, and do not change dressing once applied. Leave this to medical professionals. Kitchen burn prevention tips: never leave cooking unattended to. Establish a child-free zone around cooking areas. Keep flammable materials away from cooking surfaces. Turn pot handles towards the back of the stove. Keep a fire extinguisher accessible. Maintain clean cooking equipment. Use long oven mitts when handling hot items. Exercise caution when opening sealed hot food containers. Keep hot liquid away from table or counter edges. Supervise children around hot foods and liquids. Thank you for listening.